record. I did not see you. There we go. Now we're side by side. Okay, now we can see both of us. You're spinning around there. You're in a different, where are you at today? You're not in your office.
I'm in the playroom for the luxury boarding area.
Oh my gosh, show me the playroom. I'm going to be jealous. I'm going to be like bringing a whole litter of puppies there to work.
So the TV and the little TP and the little run through area.
Nice.
We'll go around all the way down there, and then we've got the ball pit. So it's kind of fun.
I like it.
Yeah, don't do crazy.
Yeah. All right. Well, thank you so much for joining us. Those of you that are here or, of course, log in, please ask Dr. McDermott your health-related questions. He is here today to answer them. Last time we ran out of time, like huge. We had a stack of questions still, so hopefully they'll jump back on and ask them. Show us, so do you have a home vet bag with you?
I should, but I don't. I run back real fast. So, but
it's launched, it's available. So tell everybody about it.
Yeah. So for those of you who haven't heard about it or purchased one so far, I appreciate those of you who have. We went live on the new product, which is a first aid kit for pets that I designed. It's available on Amazon. Pretty much everything you'd need for managing, situations at home and helping, either get your pet's treatment before you get to the vet, or maybe even like keeping you from having to go in the middle of the night and help out with that. It's got supplies. It's got a first aid kit with, a first aid manual with information and what to do in certain situations. And yeah, so it's available on Amazon. Just search home vet bag. I appreciate everybody's support. If you do get one, please, when you get it, check it out and post a review. If you can, it helps me out a ton as far as getting it more visible to more people. And, there was someone had mentioned the possibility of being sold out, but we are not sold out. So go check it out. We do have homevetbag.com, which is our website. And on there, it shows that the bag is sold out on there, but it's set that way. I'm not selling it on the website yet, because I want people to go to Amazon and get it there and do reviews and that kind of thing. So we will end up selling it on there soon. We'll open up the website, but my preference would be, if you can, get it on Amazon. It's easier for shipping. And then, like I said, it also helps me with reviews.
Yeah. It's Prime. Is it Prime shipping?
It's Prime. It gets you in like a day. Crazy.
Prime shipping. It's the most comprehensive first aid kit for your dog to be in your home, to take out on the road, in the car, camping, outdoors, wherever you are, you have a first aid kit for your dog. We forget that, and how often there can, just like a child, something can happen. So this is the only first aid kit developed by a veterinarian, and our very own Dr. McDermott. So go order your home vet bag now if you have a dog. Could it apply to cats as well?
Yeah, so cats, dogs, wouldn't be against using it in other animals. Like I said, it can be used in pretty much all animals. So it's very versatile. And, we're also excited. So we have also excited to announce that we had a review article that came out on it yesterday or the day before from Little Helpers Guides to Things. And it's just a website that reviews products. So they gave us a very good review and posted that. And then we've got another one coming out from a site called My Pet Needs That. And so that should be coming out soon. It's kind of cool. It's funny. One of them was like, the reviewer told me that I had to send her a bag to review. And so she had it on her countertop, and her mom came to visit and tried to steal it. It's being well received, which is great. So I'm hoping everybody gets some use out of it.
Yeah, it's over 58 items, and items that can actually help you. You did a ton of research on this. You really looked at what was being offered and really stepped it up to a complete badass home vet bag. So go order that now. All right, let's help our viewers. Good morning, Sean. Team Jeanette right away. Good morning, Carol. Jean. Jean with Shaylee is checking in. Sylvia, thank you. Saw me on Good Morning America. That aired this morning. So if you haven't seen it, go check it out. We shared a link on our page as well. Good morning, Julie. All right, we have a question for you.
Shoot.
Bernice and Andrew, this is the first time they've had a girl puppy. They took home a puppy quite a few weeks ago. She's a couple months old. When is a good time to have her spayed? By the way, order the bag. You are awesome. When can I spay a female dog?
Thank you so much. So the answer is it depends, honestly. So there's a couple of factors that come into play. First and foremost, there's a lot of information out there. I always tell people, anything that you hear from me, I'm going to base on science. So, for example, there's an old wives' tale that you have to let them go through a heat cycle or two to where you spay them. So we actually don't recommend that now. So there's science out that shows that every time that they go into heat, it increases their chance of mammary cancer. So if they don't have a purpose as far as, breeding or some other reason why they would need to be intact, then we do recommend spaying them. So I normally recommend before they go in their first heat, which usually occurs between 7 and 11 months of age. And the thing is, a lot of times you don't notice the first heat. It's silent, so it can kind of sneak up on you. So for my larger breed dogs, there is also some science that shows that, it may be better to wait till later, as late as we can, to do it, versus our small breed dogs, which have no issue with that. So small breed dogs, I usually recommend around 4 months. Large breed dogs, I recommend around 6 to 7 months, just so that we try to get it before that heat cycle, but also delay it as much as we can.
For the large breed dogs, is because you want them to be fully grown, their bones, and be at hopefully their adult weight and size. Is that correct?
Or at least close to it. There was a study that was done that showed that some of the dogs that were spayed or neutered early, and what they consider early is some of these shelters will do it at like 2 or 3 months old. So I always tell people, keep that in mind. That's what they're talking about when they're talking about early spaying and neutering. That some of them had or they had an increased chance of arthritis when they got older. And so, like I said, we want to try to get some of those developments, some of that process going before we do it. And so that's why I tend to wait till, like I said, that 6 or 7 month period.
Okay, excellent. Thank you. Karen has a question this morning. Flea treatments, treats versus dips versus collars. Which do you recommend? And do you have a specific brand you suggest or recommend?
Yes. I will tell you that I'm not an expert on fleas because we don't have them in Las Vegas.
People ask me too. I'm like, I don't know, because we don't have them.
But that being said, I did live in Texas for the first 26 years of my life, and we had lots of fleas. So basically, my personal recommendation is to use the treatments that you put on or by mouth. The collars, in my opinion, don't work that well, and they can also come off. Also, if they come off, I always worry about them eating those things, which I think would be not great. The dips are more short. They help with killing fleas that are on there at the time, but they're short acting, so they don't, that benefit doesn't stay around for very long. So normally I'll recommend either the spot on or which you squeeze onto the skin, or the pill. And so there's honestly, it's over the counter now. You can get it at Petco and PetSmart or wherever else. And you don't have to have a veterinarian's approval for it now. There's a lot of products out there. With most things, I just end up sticking with the larger companies that we know that have been around for a long time and aren't, that have good quality control. So that would be things like Frontline and Advantix, and there's one called Parastar. We use Parastar. It's made by, they've changed companies so much, but it used to be made by Novartis. I don't know who makes it now, honestly, but it has the same benefits, and it has the most common product is used as a product called Fipronil. And so it uses Fipronil just like Frontline, but it's a lot less expensive. And so it's really reasonable. So the other newer product is a product that you do have to get from your veterinarian, but for some people it's worth it, is a product called Provecto. So it's a pill that lasts for 12 weeks. So most treatments are going to last for a month. So you either have to put the little topical on them once a month or give them a pill once a month. Provecto lasts for 12 weeks, so 3 months. And so a lot of people like that. If they're already going to their vet, they just pick up the Provecto there.
Okay, awesome. Thank you. All right, Sean is checking in. He is getting ready to bring home his second 4E kennel doodle. So he has one that is fully vaccinated. They take out on walks. They want to know, what can they clean the floors with, as well as clean Rockstar's paws when he's out walking and comes back in, to help prevent parvo being brought into the house on shoes and on their established dog's paws.
Yeah, so First of all, I think the chance of that happening is pretty low. I mean, it can happen, but just don't stress too much about it. It's like I said, I've seen it before, but in 15 years, I think I've had one case that we determined that was the case, what happened. So just a good, just like normal wipe that they would have for dogs. I wouldn't use anything harsher than that for fear of, either causing irritation or them licking it off. But just they make wipes for dogs, just wiping the paws. That'd be the big thing. And then same kind of thing, I recommend, using more natural products around the house. If you're going to clean an area where, you're concerned about really decontaminating, the only two things that really kill parvo well are sunlight and bleach. So, if you have that you're worried about, you can put it out in the sun or bleach it and then wash it off before you give it back to them.
Okay, excellent. What is the best way to introduce the new puppy with the established dog, and how soon can they be together?
I don't advocate for a delay in introducing them, but what I do advocate is having a controlled introduction. So you monitor them very closely at the beginning. Also, I don't recommend just throwing them with the other dog and letting them do their thing for good. The older dog, I do recommend giving them some time away, giving them some special attention. Time that they can get away from the puppy and get a breather, but just slowly using them in that way.
Sorry, I got my little helper today. Getting my little kid fix. All right. Stephanie asked, my puppy, 19 weeks, has gotten sick to the point of throwing up in my car a few times. We are taking her longer for a trip in a week. What are some things I can do to help avoid the vomiting in the car? So motion sickness.
Yeah, so there's a product that we usually recommend for motion sickness. It's called Cerenia. It is a prescription item, so you'd have to get it from your vet. I know some people use Dramamine. I don't know the dosing right off the top of my head. I've not used it before because the Cerenia works so well. It's just one tablet and it lasts them for a day. So it was designed for motion sickness. For dogs and cats, and dogs, and we use it for cats too. But we use it now for all cases of vomiting with them. It's kind of one of our go-to drugs. So, but it is available in a pill that you can give at home, and it lasts for a whole day.
Okay. Thank you. Is it okay to give horse dewormer to dogs and puppies? Safeguard with Benbendazole, and what is the dosage?
Yeah. So the dosing is it's the same medication. You just have to be careful on the dosing. I don't know the horse concentration right off the top of my head, but you have to, like I said, take into account that you're giving something to a 50-pound dog or a 5-pound animal that is meant for a very, very large animal. So just using the proper dosing is the important part. I don't know the dosing right off the top of my head as far as like what's in it. I know that the for Benbendazole is usually 50 milligrams per kilogram. So that's fun math for you. But figuring out their weight in kilograms, and then that'll let you know the total milligrams you need, and then basing that on. It's hard because there's multiple different products that have different concentrations.
Yeah, and we have figured it out, depending again what the concentration is. So don't quote me on this, but Natalie, it's in our guide. The Panicker Safeguard Benbendazole is 0.23 mils per pound. But again, let's double check the suspension and dosage on that. But that is, we use the gallon horse treatment, and that's what McDermott has calculated for us. 0.23 mils per pound, so just a tiny, tiny bit per pound. Okay. But again, take the advice of your veterinarian as well. I talk like good grief. All right, one last question from Sean. Our dog's trainer is thinking of getting a deaf French bulldog. What challenges should she expect besides needing to train with hand commands for a deaf dog?
Yeah, one more time. It broke up what you were saying.
Oh, sorry. We have someone looking into adopting a deaf dog. What considerations do they need to take into account other than training with hand commands?
That's the big thing. I mean, most of the time, deaf dogs don't usually have much of an issue except for sleeping pretty hard. But other than that, they don't have much of an issue. Funny story, I walked into an exam room yesterday and the paper said deaf. And so I walked in and I was like trying to speak loudly to the owner. and trying to you know, be very clear about what I was saying. And then she explained to me very calmly that it was the dog that was deaf and not her. So that was a fun one. But yes, yeah, I know exactly. I wish that would have been more clear on the paper.
Okay, well, why when you're speaking to someone that speaks a different language, why do we raise our voice too, like they can't hear?
I know.
Why do we do that? I have to catch myself, like, why am I speaking louder? You don't have a hearing problem. We just have a language barrier. Speak louder, like I'm an idiot.
Even when we know that they're deaf, we still talk to them. We can't help it. You know, it's like, so,
That's true.
no, they do really well. Really see any problems besides, like I said, the hand training would be the way to go.
They don't know any different. That's the thing about dogs that are deaf or blind. They live in the moment, and they don't feel sorry for themselves, and they don't dwell, and they just, even like when you amputate a leg and they go from 4 legs to 3.
Don't even skip a beat.
They don't even skip a beat. That's what I love about dogs. Absolutely. All right, Heather's checking in. They found out yesterday that Lucy needs a mass removal surgery next week on her leg. She'll be 8 in July. Do you recommend having the senior blood panel completed prior to surgery?
You know, I'm always good. So the chance or risk of anesthesia obviously increases as we get older because of the increased chance of having something wrong in the body. I'm an advocate for doing blood work. We do make it optional at Durango. But I always tell people, like, I recommend it if it fits in the budget. So yeah, I mean, I do. I mean, like, it's one of those things where it's like, I would just hate for something to happen, and it could have been preventable if we had done the blood work and made sure that everything was working okay. In my opinion, if you take a dog that's older that has normal blood work, their risk is, once we've confirmed that their organs are functioning okay, I don't think they have that much more risk than a younger dog. So I think it's just, the more it's the unknown that increases the risk in these older dogs.
And at what age would you then consider them a senior, and you would prefer that senior blood panel performed or recommended?
We used to always say 7 was always our number. But if you look at a 7-year-old Chihuahua and a 7-year-old Great Dane, obviously they're at different stages of life. So as the dog gets bigger, that number starts to decrease a little bit. You know, a 5-year-old Great Dane in my opinion, is a senior. The smaller dogs, 7, 8 is when I start to.
Okay. All right. Thank you. Another question about getting car sick. My dog loves to go for car rides, but unfortunately she gets car sick. So Lynn, we did cover that. You can go back and review that. We're going to keep moving on because we did talk about that. And we have another one about fleas. They've heard issues about the collar. Thank you, Alex. Is there anything specific for the tear stains in small breeds? Drives us crazy. Why is it happening? What can we do? They look dirty all the time. Help us.
I know. That's $1 million idea right there. So yeah, I mean, I recommend that people, like I said, do the daily cleaning of them. The pH and the basically composition of tears and saliva will stain white or light colored fur brown. So it does the same thing with saliva. So I can walk into an exam room with a lighter colored dog, and I can tell they have allergies when I see that their feet are brown. Same thing for the eyes. I have not yet found a product that works really, really well. There was a product that people used a lot, and it's still available. And I think they maybe even changed the formulation. It's something I need to look into. But it was called Angel Eyes. The problem with Angel Eyes is that it had a low-grade antibiotic in it, and for some reason that helped. The problem is I'm not a proponent of using antibiotics on a routine basis like that. And so most vets are not a fan of that product, but I was looking at it fairly recently, and I think they've changed it. But avoid anything that has an antibiotic in it. I mean, it's not worth prettier, fur on the eyes to develop a resistance to antibiotics. There's a million different supplements. If anyone finds something, let me know, because I'd love to be able to recommend it. But like I said, haven't really found one yet that I like.
Why do some breeds have more drainage from their eyes than others?
A lot of times due to the formation of the face. So a lot of these short-faced dogs, just the way that their conformation of their face is going to make it to where they tear up more.
But they're not sick. or there's not
No.
something wrong with them. They just,
As long as the discharge isn't like doesn't look like pus or like green or doesn't have any weird colors to it, the tearing up itself is not a pathological or a problem, you know.
okay. All right. Excellent. Thank you. Aaron Brock is checking in from Florida. Good morning. Best canine allergy test.
So it's a good question. So there's really, I mean, as far as that I've used, there's two that we use most frequently. One is going to be intradermal skin testing, which is just like they do in people, where they inject a small amount of the antigen underneath the skin. They shave a big spot on your dog and they do a bunch of little injections and see if they react. That has to be done by a dermatologist. Most veterinarians, I don't know of any veterinarians that do that themselves. So there are veterinary dermatologists that do that. The one that we use is going to be something called VARL, VARL. It is, I don't really know what it stands for, to be honest with you, but it's a blood test. And so it's these things are kind of controversial. You know, a lot of the dermatologists will argue that they don't think it's as effective, but also their main bread and butter is doing the skin testing. So I don't know if that has anything to do with it, but it was actually designed by one of the veterinary dermatologists that really pioneered the profession. And I know him. He's a very smart guy. But he wrote the book that they use in vet school in dermatology. So this is the guy that designed the test. And so you do the test and it will read back and it'll say, okay, it'll look at trees, grasses, molds, pollens. It'll even look at some of the things like wool and human. So they find out if your dog's allergic to you, which happens. And then the question is, how do we use that? So avoidance is very difficult. Even if you know your dog's allergic to juniper, it's floating around the air, so you can't really avoid it. So what they do is they make allergy injections based on those profiles. So we as a veterinarian get the results back and we pick out however many antigens we want to put in there, and they make a cocktail out of it that you order from them and you inject into your dog, and it desensitizes the body to it so that they don't have as strong of a reaction. I will tell you that in my experience, about a third of the dogs that we put on it do really well on it. About a third of the dogs, it improves, but they still have some issues. And then a third of the dogs, it doesn't do anything for. So that's a big thing. They do also have a food allergy panel. And I will tell you that I personally don't think that the food allergy thing is very accurate. It sounds great, and it'd be nice to know if they have a food allergy and a quick way to test it. But food allergies are changing constantly in dogs. And so it may give you a snapshot in time, but it's not going to give you an accurate answer, in my opinion.
No, and we've experienced that. We've ran 3 food allergy tests on Hannah, and every single one came back different. So it's kind of frustrating, and we make changes, and I don't even know if it's accurate or not. So I don't know. All right, Yvonne wants to know, do vaccinations normally make puppies super tired? Valentine was so calm and slept pretty much all day yesterday. I believe that was her second set of shots.
So it depends on the dog. So the smaller the dog, the higher chance of it causing that. Vaccine reactions and issues with the vaccines are pretty rare nowadays. When I started 15 years ago, I swear we would see a vaccine reaction every couple of weeks, we'd see them pretty frequently. Most of the time it's just swelling or like extreme lethargy. And it's kind of resolvable with treating with like an antihistamine. So if you do go to get vaccines and you do feel like, they're having an issue with it, or they're uncomfortable, or they're lethargic, you can give them Benadryl, which by the way is in the home vet bag, if you're wondering, and it will help counteract the effects of the reaction. And so Benadryl is given usually at a milligram per pound. So 25-pound dog is going to get a 25 milligram Benadryl. It sounds crazy, but a 100-pound dog is going to get 100 milligrams, so 4 tablets of Benadryl. They're not near as sensitive to it as we are. So, me taking a 25 milligram Benadryl is like darting a rhino. Like I'm out. But for these guys, they're not near sensitive to it. So you can use that if you need to in situations. But yeah, they're less common. And then how many shots are we giving? Are we giving all the shots at one time on a very small dog? Then yeah, it can definitely wear them down.
Yeah. And sometimes too, just because they're tired doesn't mean they're having a reaction. It can just be from going in the car, going to the vet, stress, something new, it's new exposure. It could be an hour. And then if you do any other errands, like you don't realize the stacking stress in a young puppy like that, it could be that coupled with then also getting a vaccine. So just keep that in mind. All right, Sonal, congratulations on the vet bag. Very excited to get it. We're trying to fly Theo to Vegas to get him to Norton Dog Training. He has anxiety and refuses to get into his carrier. Is there a sedative you recommend?
Yeah, so I do use sedatives, but most of them have to be prescribed by your veterinarian. For a very long time, the medication we used was a drug called acepromazine. I still use it at times. It knocks them out. I mean, it's, the best analogy I can come up with is it's like having a few glasses of wine. I mean, it's just, what's going on, but you just really don't care that much about it. And so it does work well. There are other medications out nowadays. So there's one called trazodone, which has a little bit less effects as far as like sedation, but still does the kind of the de-stressing thing. And then there's actually a pretty cool one called Sileo, Sileo. It's a paste that you actually dispense into their mouth, into the cheek of their mouth, and somehow it stays in there, and then it sedates them. And then when you're done with it, you can actually pull it out. And I don't know how they don't swallow it. I don't know, but it stops it. So like I said, it's more of a controlled thing. And so that we've been using that one a little bit more, like especially for like fireworks and things like that. It seems to work pretty well.
Very good, thank you. Sarah and Kate are checking in from California. They just got their dog fully trained as a diabetic alert dog. But when she's running around outside, she'll just eat stuff off the ground. Anything in particular to be most careful of? Peach ate a bite of wild mushroom yesterday. They were stressed, but she was totally fine. Are there things you can think of off the ground innately that could be an issue?
Yeah, I mean, most issues that we have, the good thing is most of the plants that are toxic, nature's made them taste very horrible, which is nice. So, the big ones that we think of are going to be things like sago palms, oleanders, things like that, but they really are nasty. And so they usually don't want to eat those. I don't worry, and like things like the mushrooms and the grasses and things, I don't worry about. What we do worry about is if they eat rocks, and they eat a lot of them. So one little rock is not going to make a difference. If they eat a rock and it's bigger than the size of their stool normally is, then that might be a problem. And then just watching, depending on where you're walking, if they're just in your backyard, you don't have to worry about this. But obviously, if you're walking them in a neighborhood or out on the street, you want to watch to make sure they're not picking up like things that might be there, like cigarette butts and stuff like that,
or other dogs' poop, or
the dogs' poop.
Or dead animals, although they eat those, who knows? Okay. So many things they can get hold of. Oh my gosh. Okay. Wants to know, they've tried, I have angel eyes and I've tried everything except having them drink distilled water. We're back to the tear staining. Have you heard if that works? Distilled water for tear staining?
I don't think it does, honestly, because your body has so much. Your body is a majority fluid, and so it's already got that fluid in there and the compounds in it. And so I don't think you're going to drink enough water to change the balance of that pH or the change of the fluid in your body. So personally, I don't think it's going to make a big difference. I mean, if it does, let me know, but I don't think it's going to. I think there's more emphasis placed on that than it really is valid. I don't push for people to drink, unless they have some sort of like urinary issues, which there are some studies that have shown that the mineral content in there can sometimes affect their stones and stuff like that. But other than that, I don't really push for distilled water.
Okay. Phyllis is checking in. She has a 2-year-old terrier and he hasn't had his shots yet. I'm wondering if there's anything I can do to comfort him afterwards or what to expect. Also, because Toto is so small, he does cough, hack. I'm wondering if this is normal. It doesn't sound like a medical emergency, but enough to warrant a question regarding that.
Yeah, so I mean, there's a couple of questions in there. So the vaccine, like I said, if you're worried, either pre-medicate them with the Benadryl so you can give it to them before they go. Otherwise, like I said, we generally are pretty specific about where we give the shot. So, usually the back legs is where we're going to go. So if you want a hot pack or something like that, if you're concerned about it. The other thing is I always tell people, you know, you guys are the advocate for your pet. So if you're concerned about something that's going on with your pet, you know, number one, make sure that all the vaccinations that are being recommended are things that you need. You know, are you going to be in an environment where you're going to need that vaccination? Okay. I don't just blanketly recommend vaccines for every dog. I mean, obviously we need to do rabies vaccines for every dog as required by law, but other than that, like I said, you just to see where their need is. But also, there's nothing wrong with saying, hey, I want to split these vaccines up. And, you know, instead of giving 4 vaccines at once, you give 2 one week and you come back the next week and do the other 2. So that is another thing that can help decrease the reaction on smaller dogs.
But don't be so stressed out because they're just going to feed off of your stress. So if you go coddling and nervous and worried and fearful, you're going to make him afraid of the vet too. So make sure you're empowering him and telling him he's fine. He's a big boy. It's a little poke. It's fast. And you just have to make sure he knows he's being brave and he's fine. But if you go in feeling bad for him and worried about everything, he's not going to like the vet at all. And it's going to be even more stressful for him. So make sure he's going to feed off your emotions far more than anything else going on, including the little poke.
And the cough part of the question. So the coughing can be due to numerous things. It can be due to allergies. It can be due to allergies inducing like a bronchitis. With small dogs, it can also be due to a problem with their windpipe. It's hard to know for sure unless we take an x-ray of them. So if it's not super bothersome, then, you know, like I said, as long as they look good on a physical exam, their heart sounds okay, that's another thing that can cause coughing. But we're a pretty young dog, so I think that would be less likely. So, but if it's something that gets worse and you get worried about it, then x-ray would be kind of the next step.
Okay, good. Letitia's asking, my vet prescribed meds for mild trachea since my dog coughs off and on. It acts up randomly, sometimes nothing for a few weeks, and then a few days of coughing. Anything I can use over the counter instead of the vet prescription, the hydrocodone syrup?
There's nothing anti-cough over the counter that I usually recommend. Most of the cough syrups that you can buy for humans have things in them that are toxic to dogs. So you have to be really careful with over-the-counter cough stuff. So I think there are some products, to be honest with you, I don't use them often enough to know, and I'd be cautious about recommending ones without knowing 100%, because like I said, there are some, especially ones that have like a decongestant in them as well, that can be toxic to dogs. So you just have to be careful with that.
Okay, good. Thank you. Another question about best flea, tick, and heartworm meds. Maybe we talked about the flea medications previously, so I don't want to go over that again, but what about tick and heartworm medication? They keep hearing so many different kinds, oral versus topical. I think heartworm's only oral, but anyway, I don't know.
Right. The flea medications are also going to cover ticks. But when you look at it, make sure that you're evaluating, does it kill ticks, or does it prevent, like, does it kill the little larvae guys so is it going to kill ticks that are on there, or is it going to just prevent ticks from getting to staying on there? You know, those are questions, but most of your flea medications also cover ticks. There are heartworm medications that also cover ticks. I don't know I think there's one called Trifexis, which might cover all 3. But it's weird. Commonly, they don't cover all 3. So you kind of have to have a mix of different drugs. So routinely we use Sentinel is the one that we use. Another one that we used to use is HeartGuard. I don't think one of them is better than the other, honestly. It's just we decided we wanted to carry one product and we picked that one. And so usually, like I said, we'll combine either that with a flea and tick preventative together is what I normally recommend.
Okay. Kate has a great question. If you could give all dog owners one tip for raising a happy, healthy dog for a long time, what would it be?
Ooh, I think my one tip would probably be, so I'm going to take 2 tips. So one of them is going to be make sure you socialize your dog when they're young, because I think the development of how they act and their fear of things and their interactions of how they feel as they go through the day, as they get older, are based on their socialization when they're young. So I think that's extremely important. The other thing is, don't get caught up in all the hype. You know, there's so much information out there about pets and pet food and pet treats and this and that. And oh my gosh, you have to do this. You can't do this. Develop a relationship with your vet, talk to them, ask their opinion. Most vets, it's funny because, veterinarians go to school for a really long time about this stuff. I mean, we have whole semesters devoted to nutrition alone, yet most people will get advice from the 18-year-old that's working in the Petco or PetSmart, and trust that over what maybe their veterinarian says. There's no conspiracy out there about, veterinarians trying to push you onto this or that, or like most of we're scientists by nature, so our recommendations are going to be science. But even if you don't go by what we say, just be cautious. Like I said, there's so much information out there. And like I said, I can't imagine the billions of dollars that are spent each year that don't need to be spent on products that, like I said, are getting pushed. And oh my gosh, I can't believe you would not feed this or do that. And so, just don't get so worried about everything. Like I said, just try to, like I said, find something you're comfortable with, talk with your vet, make sure that you guys are on the same, same level. You may not always feed or give or use what they recommend, but use that as to kind of help form what you want and based on that.
Okay, good. Thank you. Here's a breeding question. Lori is looking at a sire to buy, but the breeder that owns him uses Benadryl quite frequently. He itches and when he swims and she uses it regularly. Should there be any concern in buying this potential sire that has been on Benadryl? Could there be any potential issues with semen or reproductive health?
Not that I know of. I've not seen anything like that. I mean, Benadryl's pretty benign, so.
Okay. All right, good. Thank you. Hopefully that helps, Lori. So many things we have to consider when buying a breeding stock, Yeah. All right. I think we are caught up with questions. So I know we're approaching the hour. Is there? Oh, okay. You can eat those. I want to, now that we have so many other members joining us, please tell us about your home vet bag that just launched March 3rd. Well, I'll do a little bit of talking for you. It's the most all-inclusive first aid kit for your dog. We forget this important thing when we're out with our dog, whether you keep it in your car, your home, you go camping, you go traveling, anywhere you go with your dog, emergencies do happen. The Benadryl's in the bag, hydrogen peroxide's in the bag to induce vomiting. We've talked about what if your dog eats something? What happens if they're itching? Like several things we talked about today are included in your home vet bag, which can be bought on Amazon.com, home vet bag. Tell us a little bit more about it.
Yeah, so, the process started about a year ago when I had a client ask me what they should keep at home for their pet in case there was an emergency. And I kept thinking of things and I was like, well, let's see if there's anything that's commercially available. And the products were really limited. Honestly, most of the products that you see that are available are, they're a first aid kit that someone put a picture of a paw on and marketed for pets. And so while some of those products are helpful, even some of the products in, the home vet bag are things that would be in a good first aid kit for humans. There are very pet specific products that I think need to be in there. Things for bleeding nails, like I said, hydrogen peroxide for vomiting, causing vomiting if they eat something they're not supposed to. Things like that, and then there's things that, come from experience of house calls and working on animals, stuff like that. Like I tell you, two things that were very important to me. Number one, most first aid kits for pets don't have a thermometer in them, which is crazy. And so you need a thermometer, especially if you're doing breeding, everybody. So for checking, you're going to be due, but also a flashlight. It sounds funny. We all have, I have a flashlight around the house. Well, you never can find it when you need to. So, keeping something in there, like dogs never get sick or have injuries in well-lit areas. I can promise you it's always in the dark. And so having that in there, and having it ready to go, and make sure you put batteries in it because they don't let me ship it with batteries. But, like I said, that's something that's in there that, is very helpful. And then just things on day to day, like, having a pill cutter or having something to help get the pills down if they won't take them in something else. So there's just kind of like, there's various products in there that could be help in different situations. And the goal is not to eliminate your veterinarian. The goal is to help, number one, treat minor things at home so you don't have to waste money and time going in for those. There are some things you can manage at home. The other thing is some of the other problems that are not the major things, but you may still need to see a vet, maybe keep you from having to go in the middle of the night and pay that extra emergency fee. And the manual is designed in a way that it is actually color coded with, hey, this issue is a level green. That's probably something you can deal with at home. If it doesn't get better, you should go to your vet. Yellow is, hey, you probably should see your vet, but these are some things you can do to keep it to where you don't have to go in, overnight or right away. And red is like, hey, you need to get to the vet right now. This is really a big deal. Don't mess around with this. And so we also have, if you get in the home vet bag manual, there is a QR code that you can scan that will go to an online resource for videos for all the pet first aid kits. And I made those available regardless of whether you buy the bag or not. So I'm a horrible salesman. I shouldn't tell you that, but I want to get those out there for as many pets as possible. So if you go to homevetbag.com, which will eventually have sales, but we're trying to steer it towards Amazon right now. But there's tons of resources on there as far as instructions that are in the first aid manual and the videos that go along with them that we made.
Yeah, and it can be something like, and I shared this publicly, my dogs got into xylitol, got into gum, and between the three of them, it was a whole pack. I am fortunate enough to have you on speed dial. Not everybody has that. It would then just as fast to scan, and find out about that information. And I would have had the hydrogen peroxide right there, which we did induce vomiting, which potentially saved their life because we had an hour to get to you still. So we were able to quick induce vomiting and get to the vet. So just being able to, it's like having a vet on speed dial for emergencies or non-emergencies or things you think might be emergencies or things you don't think really are, like they ate gum and you don't realize that xylitol is super, super deadly. And you think, no big deal. Hey, just go scan, go check it out. He's got it all there for you, videos, documents to read. It really could potentially, it's going to happen. You're going to save a dog's life through your home vet bag. So it really should be mandatory if you have a dog to have your home vet bag. Real quick, since you brought it up, because so many people don't know, what is a fever in a dog?
Yeah, so dogs' temperatures tend to run, and cats tend to run higher than humans. So they're usually going to range anywhere from 100 to even 103, 103 and a half. I don't start calling them a fever until they're over 103 and a half. But if you bring me a dog in the middle of summer in Vegas and it's 103, 103 and a half, I'm not going to stress about it if they're doing well otherwise. So, we get to that, higher than 103 and a half, 103.9, 104. Then we start worrying. That's when we start thinking of like a fever. So, but, it's something that just it's important to know that to have available so you can check it and see if it's something you need to worry about. The other thing that I forgot to mention is that I also am trying to get more and more information on my blog. So if you go to stuffyourpetneeds.com, they've allowed me to have a blog there. And so it goes over pet products. It goes over different supplements. We're kind of exploring some different things that we're doing and trying to get information out there. And some of it's like, I'm even looking at like funny stuff like, okay, best website for customizing items of your dog picture on it. Like we're trying to make it fun too, but I'm trying to do some educational stuff on there, and as well as guide you towards stuff that, like I said, 15 years of doing this and probably hundreds of thousands of pets. Some of the things that I've picked up along the way that might help you out.
Yeah, excellent. And for so many of my breeders that are watching, it is very normal. We're not ever really told. It's very normal for a mom to have 103, 103 and a half, 3-4 days after delivering every day. And so I don't know how many times initially when I started breeding, I'm like, are we okay? I'm at 103. You're like, it's fine. They just delivered. Very, very normal. We see it in almost every single mom. But once we get to be the 4th, 5th day, that really should come down. But just a little heads up, don't panic if it's 103, 103 and a half post whelp. All right, thank you so much, Dr. McDermott, for joining us again today to answer our questions. Truly appreciate all you do for our puppies, for our clients, and for our viewers, helping to establish a healthier, relationship between not only their pets, but with their veterinarian as well. To remember to advocate for, you are the advocate for your dog. So make sure that you have that communication with your veterinarian. And if you feel like you don't, find a new one. If you're in Las Vegas, go see Dr. McDermott at Durango Animal Hospital. He is the Dr. Doodle. I'm still waiting for the shirt. I'm still waiting for the shirt, Dr. Doodle.
We'll get there.
I'm waiting. I'm just waiting for you to show up on a show with Dr. Doodle. Those of you that saw us on Good Morning America, please, there's two things you have to do today. You have to go to Amazon.com and buy the Home Vet Bag. And then you have to jump on over to 4ekennels.com and click on Healing Hearts and donate to our charity. You'll see today on Good Morning America, yet another one of our really amazing stories, the power of a dog, that the families that are brought into our life because of the power of the dog is truly, truly incredible. Another amazing family, another amazing placement, fully trained and donated service dog. Thank you, everybody. Have a great weekend. I'm Jeanette with 4 Kennels. We're only healing hearts and changing lives with the power of a dog, but we are changing breeding from bad to
badass.
All right. Bye, guys. Have a great weekend.